Okay, so we are here. Sorry for the delay in this session. I just got the information at the last minute. So there was this delay. Today it was a session scheduled for preventive, but due to some unforeseen faculty emergency, it was not possible. So I'm taking the session on. So myself, Dr. Rajul Agarwal, and the orthodontic faculty at AIIMS. So today we are back again with the MDS 360-degree MCQ edition session. So we are, for the next 1 hour we'll be discussing MCQs. Okay, and expect you guys to give your proper feedback, proper answers for each question, even if it's wrong. Okay, as we all tell repeatedly, it's not an exam but a preparation for your exam. So even if you're wrong, okay, try to give answer to each and every question so that we can help you out wherever you go wrong. Okay. So once again, good evening everyone, and thanks all who are joining for this late night session. So beginning with the first question, image based question. The best retainer in an orthodontically treated case as shown in the given image is. Beg's retainer, bonded canine to canine fixed retainer, Hollies with short labial bow, and band and spur. So image based question. So what will be the correct answer? So if we can see the case, it's a case of upper arch. The image is of upper arch. The premolars are missing, so I assume it was a treated case with 4-4 extraction. Okay, Rit says option A, Beg's retainer. Ahana also says Beg's. Okay. Nimisha says option B, bonded canine to canine fixed retainer. Okay, so these two things we can grab from the image description. Anyone else? Okay, so the correct answer is Beg's retainer. Okay, why? So as I told you, it's a case of upper arch treated with missing premolars. So I assume it's treated with 4-4 or even you can say 5-5 premolar. Any premolar was extracted. Okay, so it's a case in which we have to prevent the space from reopening. We have to prevent this. Coming to the option, bonded canine to canine fixed retainer. If a fixed retainer is given from canine to canine, will it prevent the space from reopening? No, because the space can reopen here, here, anywhere. So this is eliminated. Option C, Hollies with short labial bow. Short labial bow is from canine to canine. Okay. Yes, Anna, you're right, to prevent extraction space reopening. So short labial is from canine to canine. So again, it cannot prevent the space from reopening up because the labial bow will cross from here. Okay, the crossover valve will lead to opening up of the space. Again, this is eliminated. Band and spur is not a kind of a retention appliance. It's a space maintainer. Okay, so the best and the correct option here is Beck's retainer. Okay, next question, easy question. Identify the appliance shown in the image. हेलो, हाँ क्लास है, हाँ ठीक. Okay, so we have people answering up. NITA expander, option A. Hello. Okay, sorry for the interruption. Okay, yes, so the correct answer is NITA expander, which you all know. Okay, so some important points about this. So it was given by Wendell V. Arndt in the year 1993. It's a fixed removable type of expander which is self-activated, thermally activated expander. Brings about slow, continuous, uniform force delivery. So what we do is, it comes in 8 different sizes. So depending upon the type of amount of expansion which is desired, we need to select the size. So what we do is we measure the interpremolar width, okay, and the width required, and based on that we select the size. What we do is put this in ice cold, so it becomes deformed, becomes super elastic, austenitic, and in the oral cavity when we put it, okay, it becomes shape memory. That it martensitic A to M transformation occurs inside the mouth or the oral cavity at high temperature. So these are the few other important points related to this. Okay, other kind of question which you can get is newest kind of expander, you can say. Technically it's not new, but this is the other word which is used for this kind of expander in your exam. Okay, next is a fan expander. This is the image of fan expander. It can bring about differential expansion in either in the anterior or posterior region. So the screw, if it's open anteriorly, will bring about anterior expansion. If open posteriorly, it can bring about posterior expansion as result. So it's an example of a differential expansion, and this is the image of butterfly expander. Okay, so next question. These were the few important points related to expander. Wilcodontics in orthodontics is a term which is used to describe. Extraction of all first molars at the age of 6 to 7 years. AOO, expansion protocol, no such term in orthodontics. Option B. Rit says option B. Ahana, Nimisha all says option B, AOO. So yes, Wilcodontics is a term for accelerated orthodontics. So what is the term for option A then, if anyone can tell? Extraction of all first molars at the age of 6 to 7 years. Sir, is it P POW? I'll get to it. It's a type of thing. So first tell me what is the name given for option A. Then I'll come to your doubt. If anyone can tell what is the name for option A. Extraction of first molars at the age of 6 to 7 years. So it is known as Wilkinson's extraction. So it was a earlier technique in which the first molars were extracted at the age of 6 to 7 years. So it was believed that in children third molars usually erupt and can take up that space, and at the same time extracting first molars will help in alleviating any kind of crowding which can later on develop. So it was not practiced now, but it was the earlier thing which was practiced. Okay, expansion protocol, you know the term was given by Timms or Isaacson protocol, and no such term. So coming to you is, so it was developed by Dr. Thomas and Dr. William Wilco. Okay, unlike usual corticotomy. Okay, so POW piezo incision accelerated orthodontics is a type or is a way of doing this. Okay, so it's part of accelerated orthodontics. Okay, there are various other ways: corticotomy, piezo incision, ultrasound, laser, okay, of doing accelerated orthodontics. Again, a very important part of your exam. Okay, so basically what we have to do is induce inflammation, and so as to that the bone turnover rate increases and the tooth moves faster. Okay, PRP, PRF, there are other ways, okay, to accelerate the treatment. Next question: the following orthodontic appliance is showing. So since the question is made by me, I can give 5 options as passive tieback, active tieback, lace back, figure of 8 ligation, or bend. It's a very important image. I think it was part of your PYQ as well. Following orthodontic appliance is showing. Option B, no one else? Okay, yes, the option is active tieback. So what is passive tie back, lace back, figure of 8 ligation, and lastly bend back? Because as I've told you repeatedly, you have to look right now, you have to look at an MCQ with one correct and rest 3 incorrect can form 3 more questions in turn. Okay, so what is lace back first of all? So lace back was the term which was popularized by McLaughlin and Bennett. Okay, so it uses 0.010 inch SS ligature and it is placed before insertion and ligation of arch wire. Okay, so in exam either you can get an explanation why is it given, or you can get a question with an image. So how will you identify whether it's lace back or figure of 8 ligation? Okay, so if the ligature wire is below the main arch wire, like in this question image, if the ligature wire is below the arch wire, it's a lace back. And why it's given? So remember, MBT brackets are pre-adjusted edgewise bracket. So whenever you place the symbol arch wire, same first arch wire, the tip of the bracket gets expressed, leading to forward tipping of the canine because of the inbuilt tip built into the canine bracket. So to prevent this canine crown from tipping forward during leveling alignment, this lace back is given and it is placed below the arch wire. Next is tie back. Tie back is for two types, active and passive. Okay, so it is placed first of all after the placement of arch wire. Okay, so active tie back is used for active space closure, like in this case. So in extraction case, you want to retract the anterior teeth so as to close the space. So this will have a module. So please explain lace back. Okay, so lace back, first of all, how will you identify? It will be a ligature wire without module and below the arch wire. So ये हो गया इमेज बेस्ड क्वेश्चन अगर आया आइडेंटिफाई करने के. नेक्स्ट, इसका पर्पस क्या है? Why it is it given? Why do we need to place this kind of a ligature wire below the arch wire? So it is given to prevent the crown from tipping forward. So why will the crown tip forward? So what happens when we place a MBT bracket? MBT bracket is a pre-adjusted edgewise bracket, means it has its own tip and torque built into it. So what will happen when you will place the arch wire? This tip and torque value which is built will get expressed. So what will happen? The canine crown will tip forward, which we do not find in extraction cases. So we place this lace back so as to prevent this canine from tipping forward. So this is the purpose of lace back. Now clear? Clear with the purpose of lace back and how to identify it? Yes. Okay. Next is tie back. So tie back is of two types, active and passive tie back. Active tie back, उसके नाम में ही लिखा है, it exerts active force. And why do we require active force? For space closure. So how will you identify an active tie back? In an image, it will have the presence of this kind of a module. Module is a elastic. So in extraction cases, you have extracted premolar, you want to retract the anterior teeth. So this module is tied with the help of this ligature wire and is tied. So what will happen? It will stretch or its diameter will increase. So what will happen? With time it will try to come back to its original diameter, taking the anterior teeth back or distalizing it and closing the space along. So that is the purpose of active tie back. Next is passive tie back. So passive means no force exert. So once the space closure is done, okay, now the type of arch ligature you will place will known as passive tie back. So without, it will be without module, just a figure of 8 kind of a ligature. And again, how will you distinguish with passive tie back from a lace back in an image? It will be placed over the wire. So this is the image of passive tie back. See, it's placed over the wire. The ligature is going over the wire, so as to prevent the space from opening. Okay, active is very easy to understand. Image, it will have a module, elastic module kind of like this. Okay, now this module can be placed either anteriorly or posteriorly depending upon the wish of the orthodontist. Okay, so do not get confused. Anywhere the module is placed, it will exert active force known as active tie back. And lastly is bend back. Okay, so bend back is for anterior posterior incisor control. So image mein, how will you identify? This is the image of bend back. The wire which is bent distally like this. Okay, so why is the wire bent distally? So as to prevent the anterior or arch wire, okay, to move forward. So it's to prevent forward tipping of the incisors. Okay, so it's given to the most distally banded or bonded molar, either 6 or 7, whichever tooth we are last include. Okay, clear? Next question. The following image depicts washboard effect, rowboat effect, wagon wheel effect, roller coaster effect. Which says option B, rowboat effect. Anyone else? Even if you are wrong, there is no issue in answering. I'll be able to help you out with the correct answer. No one else? Okay, so the correct answer is roller coaster effect, not rowboat effect. So what is a, first of all, roller coaster effect? Okay, so in again coming to an extraction case, okay, in which we want to retract the anterior teeth. So imagine a scenario, students, in which when we are retracting the anterior teeth, you apply force through e-chain or elastics. Okay, so when this force exert increases beyond the leveling tendency of the arch wire, okay, so the arch wire, if you are using an arch wire, base arch wire of lesser dimension, that is a round arch wire or a lesser dimension arch wire, what will happen? The teeth will have a tendency to tip or bend because of the excessive forces which is being applied. So it will look like a roller coaster like this, known as a roller coaster effect. You can see with the arrows showing that the teeth here have bent, the anterior have tipped like this. So always while during space closure, that is the stage 2 of edgewise mechanics, you have to use a heaviest arch wire which can passively fit inside a bracket. So for a O22 bracket you use 1925 inch SS, and for O18 bracket series you need to use 1725 inch SS for space closure. Okay, so this is roller coaster effect. So what are the other 3 effects? And first, the wagon wheel effect, which is the most common one, which you all know. So as you all know, in pre-adjusted edgewise, there is tip and torque built inside the bracket. So what happens for the anterior teeth? For every 4-degree torque, there is 1 degree convergence or tipping of the teeth. Okay, known as the wagon wheel effect. So like the spokes of the wagon wheel, if anyone would have seen a bullock cart, it has a wheel. So the wooden wheels like this. So the incisor roots tend to converge like this, like the spokes of the wagon wheel. Okay, so the ratio is 4:1. That is, for 4-degree torque, there is 1 degree tipping. Okay, so for every 4-degree torque expression, 1 degree tipping of the roots occur, known as a wagon wheel effect. Rowboat effect, which you answered, is the tendency for the maxillary teeth to tip forward during lingual crown torque of the anterior. So as again, due to the inbuilt torque of the anterior teeth, now when they are attached with the same arch wire, the posterior, what will happen? The posterior teeth will have a tendency to tip forward because of the forward torque expression of the anterior teeth. Okay, known as rowboat. Imagine the rowboat. Okay, so when you are sitting in a boat, okay, you have rows of pedal. Okay, so you move them like this to push the water back so that you get a forward thrust. Similarly like this. So similarly imagine the situation here with the pedal being the arch wire which is pushing the anterior teeth forward. So what will happen? The posterior teeth will also have a tendency, will get tipped forward due to the expression of the lingual crown torque of the anteriors. And draw one more, washboard effect. I'll come back to the drawbridge effect. So washboard effect. So you must not have seen this. Okay, so washboard was a tool earlier used to design washing clothes. It was like this. So this effect is usually seen in the lower anteriors due to excessive labial or buccal movement of teeth into the labial cortical plate. So what happens? The roots can be seen through the underlying bone like this. Okay, known as washboard effect. And what is drawbridge effect? Okay, so imagine rowboat can only be seen in maxillary arch. No, it can be seen in mandibular arch as well, but the torque value of the lower anteriors is up 0 degree in MBT bracket. Okay, so the lower anteriors do not torque so much, that's why you don't see that much amount of rowboat effect in the lower arch. Okay, so yes, if you get an assertion reasoning type of question that rowboat effect can only be seen in maxillary arch, no, it can be seen in the mandibular arch as well. Okay, what the statement you is, so it's a false statement, but it is not appreciated so much because of the less torque values of the lower anterior teeth. Okay, so coming to the drawbridge effect. So drawbridge effect is the extraction of premolars to correct anterior open bite. So imagine a situation if you have seen bridges being drawn upward so as to allow the shapes to pass between. So similar kind of situation is seen in the teeth. So in anterior open bite cases, you extract the 4 so as to bring or close the anterior open bite, so as to when you retract the anterior teeth, the bite gets closed. So like the drawbridge getting closed. So it's related to the extrusion of anterior teeth and increasing overbite by reducing the inclination of upper and lower incisors. This is known as drawbridge effect. So just remember the situations in which you see it and the images of each of these effects. Next question, a difficult or tough question if I can say. Okay, because students have repeatedly been asking me, sir, give questions from SR exam. So I picked up, or you can say modified it, tapered it down a bit from the SR question bank. Which of the following are not the side effects of using RCS arch wire? RCS is, if I help you out, is reverse curve of P arch wire. Proclination of anterior teeth, posterior open bite, distortion of arch form, intrusion of anteriors. Not the side effect. It's not a direct pick. I modified it from the SR question bank so as to bring it down at the graduation entrance level. And we have the AIIMS exam notification is out, you all know, in November. So as to give you a taste of the kind of type of questions which you can expect in that exam. Wild guess anyone can also make. I have no issues. So in AIIMS I have repeatedly been telling people, if you are able to eliminate 2 options, do attempt that question. Similarly goes for this question as well. Option D. Anyone else? So no one else is answering, so I suppose everyone else will leave this question and only one person will attempt with option D, which is the correct answer. Okay, Nimisha also said option D. So yes, D is the correct answer. Intrusion of anteriors. So what is reverse curve of P or RCS wire? Okay, Vishnu says option B. Okay, so now I have answered. I'll help you with the explanation part of this question. So reverse curve, so all of you know from your prosto classes what is curve of P. It's like this in the lower arch. The anteriors are at this level, the posteriors are there. Okay, so what is the purpose of reverse curve of P arch wire? Okay, and likewise in the upper arch it is like this when you are viewing it from buccal aspect, sideward aspect. Okay, so what is the purpose of reverse curve of P? I'll draw it with a different one. So reverse curve of P arch wire is like this. So it is given so as to provide for bite opening via extrusion of premolars. So when you will place a arch wire which is shaped like this inside the teeth. There are brackets here, premolars, molars are there. The premolars will erupt, leading to bite opening. So what will be the side effect of this form? If this kind of arch wire is left for a long time, it will lead to posterior open bite, which is a side effect. At the same time, the anterior teeth will procline, leading to proclination of anterior teeth, which is again a side effect. At the same time, it will lead to distortion of the art form, whereas it won't lead to intrusion of anteriors. Okay, so they do not cause intrusion of anterior. These are all the side effects if they are left for long periods of time. The RCS arch wire. So you understood the purpose, the side effect. So all except falling are the side effect, all except which of the following is not the side effect, or you can get a which of the following is a side effect of using RCS arch wire. Okay, so I have covered all the varieties of question which you can get on RCS arch wire. Next, for bite opening, we go and remember about absolute intrusion, pseudo intrusion, true intrusion, and all those 4 terms. Okay, so just this all you can get from your this topic of bite opening in your exam. Okay, yes, so that's why I'm saying do participate actively in these sessions. Okay, it will help you out and help you gain confidence as well. अगर आप अभी YouTube सेशन पे ही यहाँ पर जहाँ कोई एग्जाम नहीं रहा, you're not able to confident enough to attempt that question in your exam, definitely you won't be able to attend. Okay. Next question, again a difficult question. Those who would have seen this would be able to answer it. Okay, mu appliance is used in cases of MEAW. Again, if you are able to narrow it down to 2 options, do attempt it. Deep bite, cross bite, scissor bite, open bite. Again, anyone, if wild case, able to narrow it down. As I'm telling you, in AIIMS exam seats are very less. They are increasing, but they are still being able to reach it to double digits only. Okay, so if you are able to make a wild case, so I have 2 students saying open bite, no question mark, just wild case will also work here. I'm not taking an exam or judging you, even I have not seen your faces yet. So 3 students, all 3 says open bite, so open bite is the correct answer. So what is mu appliance? Mu stands for multi-loop edgewise arch wire. It has L loop between adjacent teeth. This is the image of mu appliance. So this is made up of a rectangular SS wire, preferably 1925-inch SS or 1725-inch SS. Okay, it can be used to correct the inclination of the occlusal plane, like severe open bite and class 3 skeletal relationships as well. Okay, and on top of that there is a utilization of these kinds of elastics for bite closure. So it's a heavily patient dependent type of an appliance used in fixed mechanotherapy only. So patient has to wear the elastic so as to cause extrusion of the posterior teeth and leading to bite closure. So this is the mu appliance. Again I'm saying try to answer the question so as to help you gain confidence. Which of the following are examples of active self-ligating system? So as I've told you, this is since the questions are set by me, multiple. So in this question, multiple answers are correct. In your exam, you get option A, B correct, B, C correct, like this. So you have to mark single question option only correct. Okay. So which of the following are examples of active self-ligating system? Innovation, smart clip, speed appliance, or Damon system? It says option A, D. Vishnu says option A, C, D. Anyone else? Rich modified 8 to D, Damon system. Nikita says option A and C. Active self-ligating system. So you all know what is a self-ligating system. A bracket with a shutter lock system. You don't need to ligate or place module for this archwire. So if the shutter lock is exerting active force on the below wire, both C and D, it is known as active self-ligating, and if not, if the wire is passively held inside it, known as passive self-ligating. Active self-ligating, the shutter lock will be made of a nickel titanium so that it is can exert active force inside. Whereas passive will be made, the shutter lock will be made of stainless steel. Okay, so coming to the question, smart innovation is active, smart clip is passive. It was given, it is by a 3M company. Speed appliance is active. Damon system is passive self-ligation by Omco company. Each and every point which I just wrote, be it here, the company name is important for your exam. So example of active is innovation and speed appliance, A and C. Okay. Next question. Catalan's appliance is not given for a period of more than 6 months because it causes attrition of upper incisors, causes periodontitis of anteriors, causes gingival recession in lower anteriors, causes over eruption of posteriors. This Catalan's appliance is a favorite question of the examiners for anterior crossbite correction. I think hardly a NEET or a INI exam passes in which there is a question for crossbite correction. Which appliance given, image based question, side effect of that appliance, anything. Erupting, developing crossbite, words like this are used. Which appliance will you use? It says option D. The other way of asking this question is side effect of CAD lens appliance. Side effect. Okay, so in your exam you can give what is the side effect of CAD lens appliance, or side effect of prolonged use of upper anterior inclined plane, sorry, lower anterior inclined plane. Okay, these are the other ways of asking the same question. So yes, option D is the correct, that is it causes over eruption of posterior teeth. This is the image of CAD lens appliance, also known as lower anterior inclined plane. So coming to first of all bite plane, there are two types of bite plane. It can be given in option D, option D, option D. Yes, option D is the correct answer. So there is anterior bite plane and there is posterior bite plane. In upper arch, upper anterior bite plane in upper arch, posterior bite plane is upper arch. So posterior bite plane is used for giving cross bite correction so as to cause anterior bite opening, and you can give appliance to correct it. Upper anterior bite plane is used for correcting deep bite cases. Coming to our question on CAD lens appliance, CAD lens is a lower anterior inclined bite plane. It is first of all not a removable, it is a fixed appliance as it is cemented on mandibular teeth. Brings about correction of upper anterior teeth, that is single tooth cross bite, that is of recent origin, or other words developing cross bite. So next question, if you get a question in which the tooth is fully erupted or fully developed cross bite is there, or words like fully developed won't be used, you will get a age, और age होगी generally 9 plus 10 plus, जब root form completely हो जाती है 6 to 7 years, 6 to 8 years you can say maximum is a developing crossbite, because the tooth is erupting, the root is not completing. There in that case you can go for CAD lens appliance or tongue blade therapy as well. If the tooth is fully erupted or developed, in that case you need to go for fixed appliance therapy for the correction. Okay, again the side effect not to be used for more than 3 weeks. Why? Because it causes posterior teeth extrusion, which you just saw. So these are the other things which can be asked in your exam. Beyond that no question can come. Now we have question for posterior crossbite. Give blue bite on molars. Blue bite for posterior cross bite? No. See, cross bite correct bite plates with the one which we discuss, okay, are not used for correction. They are just used for opening the bite. The correction is brought about by other appliances, so either fixed or you can give a intra-arch elastic as well for that correction. Blue bite is just a way to disocclude the teeth. Okay, you can get it in posteriorly and anteriorly. The similar function will be served like this. So if you give a blue bite anteriorly, it will cause posterior teeth disocclusion and posterior eruption. If you get it posteriorly, it can be used for the correction of crossbite as well. Okay, so blue bite, no sir, for anterior crossbite in adults. Anterior crossbite, you give a posterior blue bite, yes, it will serve as the same purpose. That is what I am telling. Either in the form of a bite plane removable appliance, or blue bite is a fixed thing. It's like a blue glue or a blue composite which is you placing on the posterior teeth. What you need is an anterior disocclusion so that the anterior crossbite can be corrected. Okay, so blue bite is not an appliance. It's a therapy or a technique or an adjunct which you use for crossbite correction. Okay, bite planes are a removable proper kind of appliance. Blue bite is not a appliance name. Okay, I hope I am clear. So these are all the questions which you can get from bite plane, which I've just summarized here in one slide. Last question. Given below are two statements. Statement 1, statement 2. Statement 1 is orthodontic tooth movement. When two forces equal in magnitude and opposite direction in same line are applied, it is known as couple. Statement 2. Couple forces will produce pure rotation movement of tooth. In light of above statement, choose the correct answer from the options given below. Both statement 1 and 2 are correct, both are false. 1 is correct, 2 is false, 2 is correct, 1 is false. So, two statements, true and false type of a question. This time I purely focused on question type of questions for AIIMS exam. Assertion, reasoning, true and false, multiple answer question, correct. Image based, which was repeatedly asked from me. Option A. Option A. So everyone is saying option A. Anyone else? So this is what happens when you don't read the question or statements carefully. You just imagine that ये previous year question है, अभी आया है. Okay, so Nikita says option D, and I would have picked the same question and retyped it here again to ask you guys and help you out, explain it to you. The correct answer is option D. So if you read statement 2 is correct and 1 is false. Couple forces will produce pure rotation type of tooth movement is correct. Statement 1 is false. Why? In orthodontic tooth movement, when two forces equal in magnitude, ठीक है, opposite in direction, ठीक है, same line are applied, it is known as couple. So couple की definition ये नहीं होती. The incorrect thing is same line here. They should be in opposite line or non-collinear forces. Parallel but not in same line. Yes. Non-collinear forces. So if this is the tooth, occlusally you are saying one should same amount of force, parallel forces but not in same line. If the one force is from here, one force same line में apply किया तो couple नहीं produce होगा, never. Okay, so please read the question carefully before answering. Concept वही है, यही silly mistake से पूरा question गलत हो गया and you lose 1 mark. Instead of gaining 4, I say you lose 5 marks. What I tell to my students is not -1, I say you lose no आता question. If you commit such kind of mistake and make it गलत होता है, so you lose 5 marks, not -1. Okay, so option D is the correct answer. So again, read the question carefully before answering. So that's it from my side. I hope my session was informative for you and will help you. So beginning from September 1, we'll have an AIIMS masterclass in which we'll be discussing questions from previous year AIIMS exam. Okay, do join us for those sessions so as to brush up your knowledge. Those who have done those questions very well can revise them for those who haven't done it or don't have seen them, can go through them, as each and every subject faculty takes up their respective questions. So do join in at 8 p.m. Monday to Friday on YouTube. It's free for all. Any doubts related to orthodontics, you all know where you can reach me. I'll be happy to answer. I won't even ask which institute, which from where you are studied. Okay, having the correct knowledge is very important, and that is about. Okay, so if anyone has anything to ask, please tell. Otherwise, I'll close the session. Yes, you can definitely be in top 5. You can be rank 1 as well. MCQ solving is the only thing which will let you gain confidence for your exam, because in exam it's a multiple choice type question. Okay, so solving MCQs, and I always say do not stick. Okay, which book do you recommend? I recommend each and every book which says MCQs for dental entrance examination. So do not leave any book. Please tell about gingival display and pitch. I not be able to help you out here, Hansika. Okay, because I don't have a image of that in right now in this presentation, but definitely in the next time I'll take it up. Okay, otherwise you can always message me, or it's there on the Alpha app on my lecture if you're part of our institute. Otherwise you can definitely message me and I'll help you out, because I don't have the image of this pitch and gingival display on this slide presentation. So coming back to it, solve as many MCQs as possible. Okay, and now is the high time from September 1 to start giving full course complete test. Okay, limiting yourself to only one subject won't help you out in your exam, because in your exam it's a combination of 19 subjects. Aligner lecture, now I have been I'll take aligner question. I cannot take a lecture on aligner on YouTube. Okay, it was not possible and I won't be allowed by the institute. Okay, I'll take up questions on aligner as I remember. I've incorporated images, appliance images as given feedback given by you guys only. I'll take up questions from aligners as well in my upcoming presentations. I cannot dedicate a 1 hour lecture on aligners. It's not possible, and it's not permissible for me as well from behind. Okay, so solve MCQs and give one complete full course test every 3 days. This is the only way which will help you gain. अगर आप खाली एक सब्जेक्ट का टेस्ट दोगे, won't be a good thing for you, because in exam it's a combination. एक सब्जेक्ट पढ़ा उसका टेस्ट दे दिया, वो तो उसी टाइम पढ़ा and it's vomited out. एग्जाम में जब आपको 19 सब्जेक्ट का एक कॉमन टेस्ट दोगे, then only it will help you gain confidence and give that test with the time frame in mind. Okay, कि वो एक शेड्यूल बना लिया 10 to 1 का और and all that, and उसी टाइम फ्रेम में you have to complete that test. Okay, so that's it from my side. Until we meet next month with the AIIMS masterclass. Thank you and good evening, and thank you once again for joining.